Hello guys, today we are going to talk about obstructive sleep apnea. Obstructive sleep apnea is a medical condition which is characterized by transient airway blocking, and it consists of apnea and hypopnea episodes. Apnea is a condition in which patient stops breathing for at least 10 seconds. Hypopnea is a condition in which patient starts breathing for at least 50% superficially and oxygen saturation decreases by at least 3%. Both of these episodes last at least 10 seconds. Apnea-hypopnea index implies the number of apnea and hypopnea episodes in 1 hour. If apnea-hypopnea index is less than 5, that means if a patient has less than 5 apnea or hypopnea episodes in 1 hour, then it's normal. If apnea-hypopnea index is between 5 and 15, then it's mild obstructive sleep apnea. And in this condition, generally non-medical treatment is used. If apnea-hypopnea index is between 16 and 30, then it's moderate obstructive sleep apnea. If it is more than 31, then it's severe obstructive sleep apnea. In moderate and severe obstructive sleep apnea, generally medical treatment is used. Signs of obstructive sleep apnea. The most prominent sign of obstructive sleep apnea is when a spouse or partner witnesses how a patient stops breathing for at least 10 seconds. The most annoying sign of obstructive sleep apnea is loud snoring. Snoring can be so loud that it can be heard from another room. It is also characterized by excessive daytime sleepiness. When the patient has oxygen desaturation, the body may understand this as a danger and may synthesize some cortisol or cortisol-like stress hormones, and it may cause a sudden awakening from sleep, and this sudden awakening may continue throughout the night. When desaturation is prominent, that means less oxygenated blood goes to the brain, then when a patient wakes up, he might experience morning headache. Nocturia and concentration deficit is also very common in obstructive sleep apnea. Depression is the most common psychiatric disorder which is seen in obstructive sleep apnea. The most prominent risk factor of obstructive sleep apnea is obesity. And when a patient is obese, his neck circumference is also large. If a male has neck size larger than 43 centimeters or female larger than 38 centimeters, then it is considered as a risk factor. Alcohol consumption and using sedative drugs cause the pharyngeal muscles to be relaxed, and when the muscles are relaxed, it facilitates the obstructive sleep apnea. Adenoid and tonsillar hypertrophy are very common cause of obstructive sleep apnea in children. As you can see here, this is adenoid hypertrophy, and if a child has adenoid hypertrophy, he might experience obstructive sleep apnea, and the only treatment for adenoid hypertrophy may sometimes be surgery. Hypothyroidism is a condition which may cause obstructive sleep apnea, and vice versa. Obstructive sleep apnea may also cause hypothyroidism. Sleeping on your back is also a risk factor, and I will talk about it in just a moment. Diagnosis of obstructive sleep apnea is done by polysomnography. This is the test which is done when a patient is sleeping. As you can see here, during this about 10% period of time, patient is not breathing. However, his abdominal muscles are contracted, and when muscles are contracted, however, there is no airflow, then it is obstructive sleep apnea. However, if muscles are not contracted and airflow is not present, then it is a central sleep apnea. Central sleep apnea is much more rare than obstructive sleep apnea, and it is generally seen in patients who have some central nervous system disorders. Most common complications of obstructive sleep apnea include cardiac complications like hypertension, acute coronary syndrome, sudden cardiac arrest, and congestive heart failure. If a patient has resistant hypertension, meaning that if he takes at least 3 antihypertensive drugs, however, there is no result, then you must think of obstructive sleep apnea, because obstructive sleep apnea is the most common cause of idiopathic hypertension. Chronic obstructive pulmonary disease and restrictive lung diseases are also very common in obstructive sleep apnea. Pulmonary hypertension can also be caused. Hypothyroidism and diabetes mellitus and metabolic syndrome can also be caused by obstructive sleep apnea. The most important treatment for obstructive sleep apnea is losing weight, because, as I have already mentioned, the most prominent risk factor of obstructive sleep apnea is obesity. Also, sleeping on your side reduces the number of apnea and hypopnea episodes. This is a very common practically used method to sleep on your side, because when a patient binds a tennis-like ball on the back, then lying on your back becomes very uncomfortable. So when you sleep, you tend to sleep on your side, and this is very commonly used nowadays. Also, not taking alcohol or sedative drugs prior sleeping is very important, because, as I have already told you, alcohol and sedative drugs cause the relaxation of pharyngeal muscles, which facilitate obstructive sleep apnea. If apnea-hypopnea index is more than 15, then a continuous positive airway pressure machine or CPAP is prescribed. However, only half of the patients who are prescribed CPAP continue using the machine, because it is extremely uncomfortable. If a patient can't use the machine, then surgery may be performed, and surgery methods are chosen based on what kind of etiologic factor the patient has. If the etiology is tonsillar hypertrophy, then of course tonsillectomy is performed. If a patient has adenoid hypertrophy, then adenoidectomy is used. If the etiology of the obstructive sleep apnea is obesity and the patient can't lose the weight, then bariatric surgery can be used. Based on etiology, some other surgery methods can also be used, like ovulectomy or ovulopalatopharyngoplasty. So that was for today. I hope you liked the video. Don't forget to subscribe, and see you next time.